Hello friends, today I am going to tell you something about the research that we presented yesterday on day 3 of EULAR 2022 at its 75th annual conference at Copenhagen, Denmark. So this was the study which was titled Improvement of Endothelial Dysfunction and Inflammation in Ankylosing Spondylitis, known as the IMPROVE-AS study. The background of this study is that cardiovascular disease is the leading cause of morbidity and premature mortality in ankylosing spondylitis. To give you an example, a patient with AnkSpond is approximately 2 times the risk of having a cardiovascular disease. The cardiovascular disease includes coronary artery disease and stroke. This enhanced cardiovascular risk in ankylosing spondylitis is driven predominantly by the chronic inflammation which induces a state of accelerated atherosclerosis. However, we do not have many scientific strategies to treat the enhanced cardiovascular risk in ankylosing spondylitis. So we took consecutive patients of ankylosing spondylitis meeting the diagnostic criteria, modified New York diagnostic criteria, and these were randomized to receive olmesartan 10 mg per day, rosuvastatin 10 mg per day, or a placebo, in addition to the conventional synthetic DMARDs that these patients were on. All these patients had an active ankylosing spondylitis. What we did in these patients, they were administered these drugs for 24 weeks. The assessments were carried out at the beginning of the study, that means at week 0 and at week 24. We assessed the endothelial dysfunction using the flow-mediated dilation, endothelial progenitor cells, the CV risk score, and we also assessed the inflammatory activity by the standard measures like the BASDI, BASDI, ESR, and CRP and AS stars. The quality of life was assessed using the HAQ-DI and the SF36 questionnaires. What we found at the end of 24 weeks was quite surprising. All these patients who were treated with olmesartan or rosuvastatin improved their endothelial function, improved the inflammatory disease activity, and also improved their quality of life, which means that both these drugs are immunomodulatory, vasculoprotective, and cardioprotective, and would provide a new mechanism to treat the enhanced cardiovascular risk in ankylosing spondylitis. Thank you.